Hello everyone. Welcome back to another lecture on medicine with Faizan. In this lecture, we are going to discuss the basic anatomy of brain on CT that will ultimately help us in recognizing brain pathologies, which we will learn in the later videos. So CT images of the brain are conventionally viewed from below, as if looking up into the top of the head. Like imagine that the patient is lying on the bed and you are looking at his brain from their foot end. This means that the right side of the brain is on the left side of the viewer, as written in bold white letters, and the anterior part of the head is at the top of the image, as shown by the arrow markers and bold letters. The paranasal sinuses are air-filled spaces inside the skull. They have several functions, of which reducing the weight of the head is the most important. Other functions are air humidification and aiding in voice resonance. They are named for the facial bones in which they are located, namely frontal, sphenoid, maxillary, and ethmoid. Note that the sinuses are best visualized in the bone window. The frontal sinuses are highly variable in appearance. Many people have no frontal sinuses at all. The sphenoid sinus can be single or separated into multiple separate sinuses. In the context of some trauma, a fluid level in the sphenoid sinus may be a sign of a basal skull fracture. Mucosal thickening of maxillary sinus is a very common incidental finding. This CT belongs to a patient who had coryzal symptoms but had an otherwise normal CT following head injury. As can be seen here, the sphenoid sinus and ethmoid air cells are continuous with the nasal airways. The meninges are thin layers of tissue found between the brain and the inner table of the skull. Knowledge of anatomy of the meninges is essential for understanding the CT appearances of intracranial bleeding. The meninges comprise the dura, the arachnoid, and the pia mater. The dura and arachnoid, you can say, are an anatomical unit, only separated by pathological processes. The falx cerebri and the tentorium cerebelli are thick enfoldings of the meninges which are visible on CT imaging. It is important to note that elsewhere the meningeal layers are not visible on CT as they are closely applied to the inner table of the skull. The tentorium cerebelli, which is an enfolding of the dura, forms a tent-like sheet which separates the cerebrum from the cerebellum. On axial slice CT images of the brain, the tentorium is faintly visible passing over the cerebellum. But as can be seen in this image, in the context of subarachnoid hemorrhage or subdural hematoma, the tent may become more dense due to layering of the blood. The falx, shown here by green, is an enfolding of the meninges which lies in the midline and separates the left and right cerebral hemisphere. Pathological processes may cause mass effect with deviation of the falx towards the opposite side. This image, which is a coronal slice CT image, shows that the tentorium cerebelli is continuous with the falx, as can be seen by green dotted lines. The fissures are large CSF-filled clefts which separate the structures of the brain. The interhemispheric fissure, shown here by aqua color, separates the cerebral hemispheres, the two halves of the brain. The Sylvian fissure, on the other hand, shown here by the brownish color, separate the frontal and temporal lobes. The ventricles are spaces located deep inside the brain which contain CSF. The paired lateral ventricles are located on either side of the brain, shown by aqua color. The lateral ventricles contain the choroid plexus, shown by yellow color. The choroid plexus produces CSF. Note that the choroid plexus is almost always calcified in adults. The third ventricle is located centrally. The lateral ventricles communicate with the third ventricle via small holes known as foramina of Monro, shown by the white color. The fourth ventricle, shown here by pink color, is located in the posterior fossa between the brainstem and cerebellum. It communicates with the third ventricle above via a very narrow canal, the aqueduct of Sylvius, which is not shown here. The brain consists of gray and white matter structures which are differentiated on CT by differences in their density, something we call gray-white differentiation. White matter has a high content of myelinated axons. On the other hand, gray matter contains relatively few axons and a high number of cell bodies. As myelin is a fatty substance, it is of relatively low density compared to cellular gray matter. Therefore, white matter appears blacker than gray matter. Just like, it appears like the wings of a bat. Pathological processes like ischemia, any bleed, any edema may increase or decrease the differentiation in density between gray and white matter. The brain has paired bilateral anatomical areas or lobes. These do not exactly correlate with the overlying bones of the same names. On both sides, the frontal lobes are separated from the parietal lobes by central sulcus, shown by the arrowheads. Note that the frontal lobes are large and the parietal and occipital lobes are relatively small. Important gray matter structures visible on CT images of the brain include the cortex, insula, basal ganglia, and thalamus. The cerebral cortex is a layer of gray matter formed in gyri, which are folds over the entire brain surface. Note that the cortex appears white or denser than the underlying white matter. The insula forms an inner surface of the cerebral cortex found deep to the sylvian fissure. One take home message from this lecture I want you all to remember is that loss of definition of the insular cortex may be an early sign of an acute infarct involving the middle cerebral artery territory. The basal ganglia and the thalamus are important gray matter structures which are located deep to the insula and they are easily identifiable on the CT brain. Basal ganglia consist of caudate and lentiform nucleus and can be seen here. Insults to the basal ganglia may result in disorders of movement. Parkinson's disease, Huntington's disease, and hemiplegismus are the well-known diseases affecting the basal ganglia. The internal capsules and the corpus callosum are clinically important white matter tracts. The internal capsules are narrow white matter tracts which contain a high number of axons connecting the corona radiata and cerebral hemispheres superiorly to the brain stem inferiorly. Each internal capsule has an anterior limb and a posterior limb connected at the genu shown by the asterisks. The internal capsules are supplied by perforating branches of the middle cerebral arteries. As these vessels are small, they are susceptible to lacunar infarcts, a term you might have heard a lot in neurology classes. Even a small insult to the internal capsule can have a profound effect on motor and sensory function. Superior to the internal capsule, the white matter widens out into corona radiata and then into white matter of the cerebral hemispheres. The corona radiata of each side is interconnected via the corpus callosum. The anterior part of the corpus callosum is called the genu, and the posterior part is called the splenium, as shown by red circles. Malignant lesions of the brain can grow from one brain hemisphere to the other via the corpus callosum. Elsewhere, the fox acts as a relatively barrier to direct invasion. The posterior fossa accommodates the cerebellum and brainstem. Superiorly, the cerebellum is separated from the cerebral hemisphere by the tentorium cerebelli. Now, the blood supply of brain. Different areas of the brain are supplied by the anterior, middle, and posterior cerebral arteries in a predictable distribution. The posterior fossa structures are supplied by the vertebrobasilar arteries. It's quite worthy to mention that the arteries of the brain are not well visualized on conventional CT, but a knowledge of the areas of the brain they supply is helpful in determining the source of a vascular insult. The anterior cerebral arteries supply a narrow band of cerebral hemispheres adjacent to the midline. The middle cerebral arteries supply the largest area of the brain. Multiple tiny perforating branches of middle cerebral arteries supply the region of basal ganglia and insula. As already mentioned, the vertebrobasilar arteries, shown by the green color, supply the cerebellum and brainstem. There are several structures in the brain which are considered normal if calcified. Knowledge of these structures help avoid confusion, especially when considering if there is any intracranial hemorrhage or not. The commonly calcified structures include the choroid plexus, the pineal gland, the basal ganglia, and the fox. As already mentioned, the choroid plexus of the lateral ventricles, shown here by red circles, is almost always calcified in adults. The pineal gland, shown by green, is located immediately posterior to the third ventricle. It is very commonly partially or fully calcified in adults. Shown here in red circles, calcification of the basal ganglia is common in elderly patients. Now look at this image. The white matter area around the fox, is it blood? Well, the fox is commonly calcified in adults. If viewed on brain windows only, calcification of the fox can be mistaken for acute intracranial blood. Use of CT bone windows show calcification of the fox more clearly. So that was all about the CT brain anatomy. Watch it again and again to memorize the important aspects that can be helpful in recognizing brain pathologies. And yes, don't forget to subscribe. Thank you.